We begin with Ariana Smith, a 16-year-old girl from Taylor, Michigan. Ariana was an active, healthy teenager and had no idea she had a dangerous aneurysm in her heart that could take her life at any minute.
When I found out about the aneurysm, I just felt very shocked.
It all came to light when a doctor refused to pass Ariana's younger brother, Eric, on his sports physical. Eric had been diagnosed with a heart murmur as a child, and the doctor wanted him to see a cardiologist just to be safe.
I went home immediately and called to make an appointment, and as the phone was ringing, God must have put this in my head to just go ahead and make an appointment for all my kids.
The other kids' tests came back fine, but Ariana's test revealed an abnormality in her heart. She was referred to the experts at the Children's Hospital of Michigan, where she underwent cardiac catheterization, a procedure where a tube is threaded through the blood vessels to the heart. Pediatric cardiologist Daisuke Kobayashi performed the procedure and was surprised by what he found.
Ariana had so-called aortic aneurysm. Aortic aneurysm is abnormally enlarged sac formation of the aorta. If her aortic aneurysm ruptures, that can be fatal.
Ariana's aortic aneurysm was so unusual that Dr. Kobayashi consulted with fellow pediatric cardiologists Dr. Daniel Turner and Dr. Thomas Forbes to discuss how to proceed.
We sat down with our surgeons and 15 other cardiologists and groups around the city to discuss what would be the best treatment option for her.
They determined that surgery was a high-risk option for Ariana because of her age and the size and shape of her aneurysm.
Dr. Forbes and Dr. Turner and myself felt that we can treat her by catheter route without surgery. However, treating her condition by catheter intervention is not a simple procedure, and we want to be sure that we can succeed.
The doctors decided they would use a stent with a special lining to block blood leakage inside Ariana's aorta. That's when the idea to create a 3D model of Ariana's aortic arch came up. Working with a company called Materialise in Plymouth, Michigan, an exact replica of Ariana's aorta was printed in soft rubber using 3D technology. The doctors were able to touch it, hold it, and perform a dry run to figure out the best way to place the stent. This was the first time that 3D printing had been used to facilitate a pediatric stent procedure in Michigan.
That in of itself has changed the way we do medicine and allows us to find the best device, find the best surgical way of treating various lesions that we otherwise would just have to look at a two-dimensional picture and kind of guess what we would do. A three-dimensional model takes that out of the picture and allows you to actually perform the procedure before you have the patient on the table.
The other thing is very useful to explain the heart condition to the patient and family.
It was just cool to look at, because who has a model of their heart? Knowing that they were gonna practice before my surgery, it made me feel a lot better because they have a feel of what they're gonna do and how they're gonna do it. So I felt pretty safe.
When it came to the actual catheterization procedure, it went exactly as the doctors planned. Afterwards, Ariana spent just one night in the hospital, compared to at least a week if she had gone through open heart surgery. Recovery from surgery could have taken about 6 weeks, but with catheterization and stent placement, Ariana was back to her normal activities within a couple of days.
I think the 3D modeling of congenital heart disease, we're just scratching the surface with that. I think anytime you understand what you're up against before you're actually treating it, you get the best results for the patient.
The doctors at Children's, they're wonderful. From the very beginning, I felt very comfortable with them. They have a great team. I appreciate them and I'm so grateful for them.
I feel great. I feel healthy, in shape, just blessed to be living.